so that we can share this with the members who aren't able to join today. So I'm going to move on to introducing our guest speaker, Ms. Belen Rogers. She is the Nutrition Programs Coordinator at the Food Bank of Central and Eastern North Carolina. She has met communities across 17 counties and has designed activities and workshops based on communities' interest in food and health. The Food Bank of Central and Eastern North Carolina, also known as the Food Bank, is a nonprofit organization that has provided food for friends and neighbors facing hunger in 34 counties in Central and Eastern North Carolina for over 40 years. So with that, I would like to give a big welcome to Ms. Rogers, and thank you for joining us today.
All right. Thanks, Marlene. Hi. I'm just going to get my PowerPoint up. Okay. Can everyone see that okay? Okay. Wonderful. Well, I'm very grateful to have been asked to kind of talk about my day today. I have come to 3 or 4 task force meetings and was lucky enough to meet a few people from Mexican last month in person. So my name is Belen, and I'm a dietitian, and I work for the Food Bank of Central and Eastern North Carolina. My role here at the Food Bank is Nutrition Programs Coordinator. So I'm going to touch on a little bit of like a general, what does the food bank do? And then go into my team and my department. Okay, most general, the food bank covers 34 counties in North Carolina. The Food Bank of Central and Eastern North Carolina does. We are part of the Feeding America network, which you may have heard of in other places if you've lived in other places in the country. So every county in the United States is covered by a food bank through Feeding America. The food bank that I work for, the one of Central and Eastern North Carolina, covers 34 of those counties. Across those 34 counties, we have 6 branches, one in Raleigh, one in Durham, one in New Bern, one in Southern Pines, and then one in Wilmington. The reason we have 6 is so that partner agencies, which can be soup kitchens, after school programs, most often food pantries, or other community organizations, so that they don't have to travel more than an hour and a half. We have all of these branches, and that's for reasons of food safety, because they are bringing food back and forth. And then also, oftentimes it's volunteers, and often people are very busy who are working in this kind of space. So that's one of the reasons why we have 6 branches. And we know that the communities across these counties are all very different from each other. And I've gotten to know that too through this job. Again, most basic thing that the food bank does is distributes food. That's what we do. We get it from different sources and then distribute it out. Because unfortunately in this society, this food access might be difficult for people in different situations. So the emergency food system was built to cater to those folks in those situations. That's most basic, is just getting food in, food out. I wanted to share this resource as, if some people in your community who are in some situations where they're looking for food in this way. There's some good resources out there. This tool that I have some pictures of is called the Food Finder. I'm going to share the link in this chat. Oh, just 1 second. But basically what people do with this tool, is you can enter your zip code and oops.
And then I can help you with sharing the link in the chat if you'd like.
Okay. I think I just got it. There we go. Okay, I accidentally sent a picture. I sent a picture that's in one of the slides coming up soon. But um basically what people do is put in their zip code and a list of food pantries or other resources in their area close to them come up. We always recommend to people to call the places before they go because sometimes the hours change. The list needs to be updated pretty often because these things change a lot, but this is a first start is great. And sharing this resources with people is a great first start. I know that some of the pantries have volunteers who are Spanish speakers and staff who speak Spanish, and some do not. I don't know across all of these pantries what that looks like in those communities. And then some pantries do ask for photo IDs, and that's just for recognition of like where people live. And for other reasons, sometimes it's a national requirement for pantries that are in a national system. We are trying to steer away from that. So if you have thoughts and feelings about that, please share with us. But we are trying to steer away from that, and not all of the pantries do ask for that. But basic first kind of food bank gets food out, and there are some resources that you can share with people. And then in my department, we kind of try to ask the question of why are people using food pantries? Why is that need there? In my department, we have a jobs training program that we support community colleges who train in like CDL truck drivers certifications. And then we also have folks who guide food stamp applications so that they can shop in, different places that take food stamps. And then my team, we kind of get to talk about how does the food that the food bank distributes, how does that impact someone's maybe health condition? Is that food that people in your family enjoy? And also we get to give ideas of like if someone gets a box of items that don't seem to go together, what are some ways to create recipes from that? So my team, we get to talk about the food. It's not just a product that comes in and out. It's something that you may sit with, that you may enjoy with your family, that you can celebrate. And so that's kind of what we get to touch on in this cycle of maybe healthcare costs can be very expensive. How can we prevent using diet? So we kind of try to get into the cycle of why people are needing to use the emergency food services. This is our team, and I just wanted to share this so that you see, if you see some of these names, you'll know that we're on this nutrition programs team. So Sarah, Jenny, Kathleen, and I are on that team. Part of what we do is, like I said, share recipes of foods that we see very often come through the food bank. And some things are unfamiliar to me. Some things are just there's a box of food and the items do not seem to go together at all. So what are some ideas? We get to create material that shares some recipe ideas and also handouts related more to either food and health or different seasons of produce. All the materials that we have, they are in English and Spanish right now. We have translated some into Arabic, Haitian Creole, and Russian and French too, because that's what we've heard across our community, that those are some languages that they're hearing in their food pantries. This is actually at the Seeds of Hope in Wilson. I was just there in April and I got to meet a few folks from Mexican there. And I really just wanted to find out what material might be of most interest to this particular community here, so that I can then create more material like that and then be able to share that out. So again, I get to talk about the food, which is great. Okay. I get to use the material too that we develop. Um, And say I have created a recipe or gotten community input about a recipe that they might want to see. Sometimes we do just sample that out. And then sometimes I'll go through the whole recipe preparation, and something we call like a recipe demonstration. And so I can go and do a one-time event with a community, and completely cater that to whatever people might be interested in. So if a community has questions about a particular item like eggplant, I would go and do a recipe and just kind of talk about preparing that, cutting butternut squash, or just kind of connecting whatever people's situations are to food. So I've done snacks for children. What are some ideas for snacks for children? Um, and lots of using lots of items that people see at food pantries. Okay. A lot of the programs that we work with, or a lot of the communities that I work most closely with, are involved in the Healthy Pantry program that our team um, has created. These are food pantries that have opted in and have a particular interest in the food that they have at their pantry and health and nutrition. They have expressed an interest in that. So these pantries, which I did just list the ones that are in Pitt County, because I know that's where a Mexican is. But you all, I think on the call might be part of many different counties. But this is the list of the ones in Pitt County. They have to have some sort of nutrition education, either once a month, once a quarter, or once or twice a year. And so they just have an interest in it. They have an interest in the product. They have an interest in learning about what their community needs nutrition wise. And so that's just, some pantries have the resources to be able to learn a little bit more about that, and we support them in that way. These pantries also have to offer some sort of choice in their spaces. So instead of just offering one box, like one size fits all, someone might come in and mark down like, oh, someone in my family cannot drink milk, so we would prefer not having milk products. We try to promote that environment of choice across the pantries too, just because people do have different needs and food needs. And these are the pantries that we work most closely with. So if you do live in Pitt County and want to take note of this, these would be great places to refer people to. The ECU Purple Pantry, I believe, is just for students, but the rest of them are in the area. Like I said, these pantries also, one of the requirements for the program is to offer some sort of nutrition education. And there are, like, we do nutrition education through my team, but there are also other resources in the counties, through cooperative extension, through other kind of folks who are doing nutrition education. So we sometimes just connect the community organizations to other people that are closer to them, and may even know their communities a little bit better than I would, because I work with a lot of counties. So these are also just some resources that, if you are interested, these are some organizations that do nutrition or food education. I know Tanisha does some food preservation and nutrition. Um, and then I also mentioned that we create recipes using some of the foods that we see at the food pantry. I am still learning about what is most commonly eaten across the community and at the food bank. And so we have learned a little bit about some items that may be popular in the Latino community. I'm really interested in hearing more from this group about what might be popular, what may make someone most excited at different points of the year because of holidays, what have you, so that I can create materials that are more fitting for people that people may recognize better. Or even hopefully one day be able to provide that more through the food bank. Um, and just to know so that I can have conversations. That is really nice. But we learned some through a survey through a Mexican too, and through other resources. So we use this at the food bank. And then we also get feedback sometimes from folks. So I believe this is from NC Fields, and they were just kind of telling us what their community is interested in, which is really helpful for us. And sometimes it does feel like it takes a long time to put this feedback into practice. But yeah, we're definitely working on it. And if you have thoughts on that too, I'm very interested in hearing. Okay, and then that's really all I have. I wanted to share just one more thing is that I am involved in some of the food councils and food committees across our region. And these are just people who are involved in the food system and they come together and talk. And one of them is the North Carolina Food Systems Advisory Council, and they do a lot of root cause work through policy. And so if that's something that people are interested in too, I will put their email in the chat because it's a great place for advocacy. And definitely more thoughts and ideas need to be heard. So that's what I have.
Thank you, Belen. So I did
Yeah.
have a couple of questions, maybe just to start the conversation. So the first one was, do you know of any other colleges or universities that offer food pantries similar to ECU?
Any colleges that have food pantries similar to ECU?
Yes.
Mhm.
Associated with the food bank?
Oh, sure. So we work with Wake Tech. We work with Durham Tech and Cape Fear Community College too. They work with our workforce development. I don't know if they have a pantry. I'm trying to think of any other colleges. Oh, NC State also has a food pantry. Um, Pitt County Community College does not that I know of. But yeah, those are the ones that come to mind.
Thank you. And then
Mhm.
my second question was, what are some of the biggest challenges that you face in promoting nutrition education and healthy eating habits within the community? And how do you address these challenges or
Mhm. Yeah. Um, I guess it in some ways it's hard to talk about an ideal diet. It's impossible because it's not universal. And also I think some food patterns are just not available to everybody. And so talking about an ideal with nutrition is just impossible. And um, I think people are looking for answers sometimes and things that will hopefully be very quick um, and simple solutions, but it's just not that way. So coming across um, limited resources is probably one of the biggest challenges, and being able to share that um, food is more than just something that you take into your body, that it's more related to culture and things like that. Trying to wrap my own mind around that, and then helping others be able to see that too.
Thank you, Belen. And
Mhm.
Lisa had his hand raised.
Mm-hmm.
Hey, Belen, quick question. So you mentioned that your team works with why are people using the food pantry. Can you share what you've learned from the various communities that you served as to are there any I guess ties or is there anything that you're seeing that's being duplicated? Any trends? That's the word that I was looking for. Any trends that you're seeing in folks
Mhm.
having more need to use food pantries?
One of the biggest things that I've heard a lot is that when after the pandemic, um, the resources that were just for the pandemic, like extra money on the food stamps, when that was taken away, a lot more people started using the food pantries again. And I think, yeah, just the increased price of food, people talk about that a lot. Um, and I also think that people may be hearing more about food pantries too. Um, of course, there's a need, but I think that is coming across a little bit more, like the word is getting out. But definitely those when some of those pandemic resources were taken away, that caused a big spike. Yeah. Have you heard anything else, Leo?
Inflation, like you said,
Mhm.
higher cost, the cost in prices of food, in things in general, and raises not being there
Mhm.
or salaries not kind of going at the same level.
Yeah.
Also, it's been interesting. People are kind of working multiple jobs, right? So, they'll have
Mhm.
a full-time job and then they'll do something extra, the gig economy on the side, trying to
Mhm.
make ends meet.
Mhm. Right. And sometimes that just doesn't work with food pantry schedules either. Like if someone is working two jobs, when might they be able to go to a food pantry, especially because a lot of food pantries are open during the weekdays, between 8 and 5. There are definitely some open on the weekends and at night, but I think majority is those kind of 9 to 5 weekday hours. Um, but thanks for the question.
Hello, Miss Rogers. Can you hear me okay?
Yes.
Yes.
I have a question. I know recently I live in West Greenville area, and we have some of the houses here that do get food bank.
Mhm.
Uh, so I've seen that they get fresh foods, which is very nice. Healthy foods, that's very nice. The only thing is sometimes it would be good if they include some kind of education, for example, for fresh foods. Um,
Mhm.
I saw this on YouTube hack where it says if you put them in the like especially the leafy greens, if you put them
Mhm.
in the baking soda and water, then all the bacteria will kind of die off because of the alkaline, and then dip them again in the fresh water. That
Mhm.
way, you're sanitizing, the foods because people who donate um, at food banks usually they're trying to, make the best of what, you know, mm, best of the food they can, not throw it away. So do you have any screening mechanisms at the food bank? And can you talk about what do you guys do to discard maybe molded food? And because sometimes that is a concern. And if you can share some hacks of food safety, that would be great too. Thank you.
Mm. Awesome. So I guess, yeah, interests and tips on food storage and kind of distributing produce. I didn't know about the leafy greens and baking soda, but I will look into that. So produce can be very difficult because sometimes we get donations that are already refrigerated, and like I don't put sweet potatoes in the refrigerator when I get them from the grocery store, but at the food bank, since they're donated on a refrigerated truck, we have to keep them refrigerated. So some of those things is just like the bulk of produce. It changes storage because it's already been at one temperature. It has to stay that way, which is something interesting and new that I've come across at the food bank because it's so much product. To your question, if something is moldy or if a box is leaking, we don't distribute it. And if
Yeah,
something, oh yeah,
thank you. Thank you very much for sharing that because, you know, a lot of people sometimes they feel that food banks just distributes food, you know, that's not safe, and that's not true. You know,
Mhm.
you do have, you know, some checks and bounds in place where you kind of make sure. I mean, not too much. Some of the things before cooking, people have to do it at home, you know.
Yeah. And definitely it is so true that like sometimes we get big 50-pound bags of things and maybe like a couple things in there are moldy. And that's hard too, because it's like, do we throw away everything in here because two of them are moldy? Sometimes we don't see it. But then sometimes we do have to just throw everything out.
No, I think
Um,
the important part is make the best of whatever food you got. Make the best of it, you know. So it is probably it's a kind of sensitive issue. So I thought maybe you could share what you guys do,
yeah,
you know.
yeah. I also like that you're bringing up kind of there's so much dignity in getting food that's not moldy, so that you don't have to just do it yourself. Um, yeah, if something, again, like if something is bad, if a whole bin is bad, if there's one thing moldy in a bag, we do tend to throw it out. And then the temperature control, like if something comes refrigerated, it has to stay that way. Um, and then we have specific expiration date regulations too. So we take things that are a little bit past expiration dates that are still fine to eat. And um follow we follow those regulations too. So we do have something for that. Other than that, kind of food safety and mold wise. We have checks for the food pantries environments themselves too. We do go to those places for support visits and make sure that they have the equipment that they need to be able to store. So if you are distributing produce, you have to have a refrigerator. That's just part of the food pantry regulations too. Um, so there are definitely some things in place and it's not going to be perfect all the time, but yeah, it's I really appreciate you bringing it up.
Thank you. Thank you for sharing.
Mhm.
Thank you, Rod. So that is, I don't know if you get food banks does share ways to maintain the food fresher.
Yeah. Um, we do have some things on storage tips, so I can send that to you.
That would be nice. Thank you, Belen.
Mhm.
I know Raj had another question as well. He mentioned, I don't know, Raj, if you want to elaborate, but it was on the food safety has improved since COVID-19, but there has been a link. Also, he shared an article from 8 months ago about Sarah's concern. So Raj, if you want to elaborate more, if that was a
Yeah,
question
sure.
just asked.
So I think here, when it comes to food safety, it's all some responsibility also depends on the person who receives the food. Because here Sarah is sharing a concern that she was not able to check the food and she became sick. Okay. So that's not fair in, you know, to food banks because as Mr. Rogers pointed out, you know, that, you know, foods are often, you know, in a big bag, they may find one or two, you know, stuff that may not be consumable. So I think the important part is if food bank makes a policy on what is the responsibility of the people who receive it. And some of the tips that I shared, like, there's quite a few in the, I will email you, Miss Rogers, about different food safety where the you put a teaspoon of baking soda in a whole gallon of water, and you dip any food in it, let it sit for 1 to 2 minutes, you take it out. That actually disinfects any pathogen that are there. Now so if you just kind of blankly explain that this is the responsibility of people who are getting the foods, just a pamphlet, that would be kind of um, you know, save some bad press is what I'm saying. You see what I'm saying? Thank you. Thank you. So
Yeah. And I will definitely take a look at this article. I know, so the entire, what they call like the emergency food system or charitable food system, is covered by the Bill Emerson Good Samaritan Act. So any food that's donated, it's not the legal responsibility of the food bank, the food pantry, or whatever community organization. It's not that they don't have the responsibility for food safety or for people getting sick from anything, unfortunately, because the foods are donated. So, and that's in place so that people don't have to be afraid of giving food. There are definitely checks, and this is good conversation for me too, to kind of share how to look at foods and see that if they're okay to eat or not. And I had one other thought. Oh, we do have a food safety committee too at the food bank. And so if there is an item that is recalled, we take that out. We have volunteers who look through all of the items and make sure that those are not distributed. The one that comes to mind is an applesauce that got recalled earlier this year. And so we don't distribute that now. And so there's a food safety committee. The recalls are very quick too. So we definitely have that in place.
thank you, Marlena. Thank you, Miss Rogers. That was very helpful. Thank you.
So Leo?
Yeah, sorry, I had a follow-up question. So, I want to preface this by saying, here at Blue Cross and Blue Shield, of North Carolina, over the last 2 years, our executive leadership and team went around the state and visited all 100 counties on our Extra Miles tour. And I want to share a link of what we learned. But one of the things that we heard was food insecurity in many counties across the state. So my question is around that fresh produce, and increase of healthy foods, because these are things that we heard from communities. I don't want to say in all 100 counties, but in the majority. We try to filter through the things that we heard, and some of the things that came up was having more access to fresh produce. From the food bank's perspective, are you getting it enough, or is there more of a need in this area?
Yeah. So I definitely I've been at the food bank for a year and a half, but that's fresh produce, fresh fruits and vegetables is definitely like highest desire from food banks. If we do surveys, if food pantries do surveys, or just ask, fresh produce is definitely one of the highest, along with like eggs, meat, milk. But fresh produce, I've definitely also heard that a lot. The food bank is definitely working on it, on getting more fresh produce and distributing it. 52% of what we distributed last year was fresh produce. It is definitely harder for individuals to donate. So like, say your household wants to do like a food drive, it's really hard to give produce because you need it to be refrigerated. Sometimes it can be great quality and sometimes it's not. And since it moves around so much, it is harder to donate. So we do have sources of just produce, and sometimes grocery stores or like a Walmart will share their produce directly with pantries so that it's a shorter time frame of sharing that produce. So I know it's something that has increased across the past few years as we're trying to get more produce. And we've been working more directly with farmers to get produce that people like, specific ones that people are asking for too. So
I just had a quick follow-up because as a funder, Blue Cross Blue
Yeah.
Shield, we do funding in many different areas. And in the past, we have funded projects around food insecurity. So this topic was of real interest to me. Are there any ways to track total cost of care savings? And the reason why I mention that, I know that Blue Cross has been exploring programs such as food is medicine. If you
Yes.
eat healthier, you're more likely going to be healthier. So e- I'm just I'm just sharing kind of some of the things that we're doing and some of the things that we're looking to see impacts over the next couple of years. And one of those being track, total cost of care savings. Is that something that the food banks work with? Do you track like individuals who, or do you survey? That's what I should ask. Individuals who kind of come in, or is there an opportunity to do that with the different food pantries that you have?
Yeah. So the individual data, usually not, because it's someone, it's usually anonymous, but I can connect you. We have a healthcare partner team. So if you email me, I put my email in the chat, I can connect you with our healthcare team. Yep. Because the food is medicine is becoming very popular. Yeah. Hi, Erica.
Thank
Sorry
you.
to shout you out. I've worked with her organization before. It's good to see you.
Well, thank you, Belen, for sharing these responses. I don't know if this is one last call for any more questions or comments. If not, I want to thank you again for joining us this morning. We appreciated all the information. We were very grateful that you were able to join us today. So I do want to
Thanks for the invite.
let me see if I can share my screen again. I know I wanted to get to your guys' updates, but I do want to share a little bit about what Mexican is doing the rest of this month. So our tutoring program for Pitt County has paused until August. For Wilson County, our last session will be May 29th from 6 p.m. And then our last 4-H program meeting for Wilson County will be this month as well. So our food drives are still continuing. So June 7th will be our next one. So we have some upcoming meetings and trainings that we have available that you guys are, if you guys are interested in joining, you guys can. So the first one is our NC Farm Worker Resource Network. That will be this Wednesday, May 15th at 10:30 a.m. Eastern Standard Time, and we'll be sharing this information in the newsletter this week. We have a mental health training also in person on Thursday, May 16th from 9 to 5 p.m. and it will be in office. So here in our Evans Street office building. And we can share details if you guys are interested in joining that. Next, we have a culture and community health fair. It will be in Duplin County, specifically at the NC Cooperative Extension Center. And this will be Saturday, May 18th from 12 to 3 p.m. So everyone's welcome. I think we still have available spots for agencies or organizations to join us that day. So I'll put Bianca Perez's contact information in the chat box. Next, we have a virtual community town hall titled Minorities in North Carolina. So this will be on next Thursday, May 23rd at 10 a.m. And it will be via Zoom, so the meeting ID will be shared. But then again, I will share this in the newsletter so you guys can have the direct link. Next, though, we will have an NC Latino Resource Network meeting on Tuesday, May 28th. At 10 a.m. as well. And then next month, we will have our NC Latino Community Task Force on June 10th at 11 a.m. So we're going to be having a guest speaker from NC Child, Michael Cooper, sharing a little bit more about the data that they've collected from this past year. So it'll be a good one to join. And finally, we have our save the date for our next NC Latino Health Agenda Conference, addressing health equity across North Carolina. This one will be in Charlotte. So it's a little far, but hopefully we're able to reach the other members that aren't able to join, the ones that are more local to Raleigh and Eastern North Carolina. So the link to register is there. And again, we'll share this in our newsletter. And then next, I would like to hear from you guys. So I am going to go around and if you could please name, title, organization, and any upcoming events that you guys might have. So I'll start off with Carissa. Harding, good morning.
Good morning. My name is Carissa Harding. I'm the Day-to-Day Action Manager for, I work for the North Carolina Department of Health and Human Services with the Communicable Disease Branch. Currently, do not have any true upcoming events. We actually fund agencies that provide HIV care and prevention services. And so right now, we just attend and support the agencies that are actually doing client-centered care and prevention.
Thank you for joining us this morning. Next, I have Carlotta Dixon. Good morning. We'll move on to Carolina Diaz. Good morning.
Hi, good morning. Sorry, I couldn't unmute myself. Can you hear me?
Yes, ma'am. Good morning.
Hi there. My name is Carolina Diaz, and I am with the Department of Commerce, specifically with the Division of Employment Security. We are part of a recent program that is doing outreach among the community for access and equity. We don't have any specific upcoming events, except we are doing a webinar to give up more information about the program with Amex Can on May 30th, I believe. I think it's a Thursday. But I'm sure Amex Can will send more information to come, and then we can share more. Thank you.
Thank you for joining us today. Next, I'll move on to Erika. Good morning, Erika.
Buenos dias. My name is Erica Reynolds. I work with Trillium Health Resources. You'll have to excuse me, my allergies are attacking me this morning. We're in the process of developing a couple of events. We don't have dates yet. We're waiting on final approval. However, I'll be happy to share those once we have those dates finalized. But we're working on a couple of resource fairs, health fairs, and as you know, we have a 46 county service area, so it's quite a lot of people to service. So we're kind of regrouping and trying to get some things off the ground and work with some community partners. But once we can finally get all the dates and times finalized, that's when I can share. I don't want to put the cart before the horse, but we're excited. I'm especially excited. So
thank you. We look forward to it. We'll be
Thank
happy to share with everyone.
Okay.
Thank you. So next I have Erika's iPad. Sorry, Erika, I didn't know your last name.
Which Erica was that?
This Erika.
Romero, sorry. My name is Erica Romero from HINFAC. Here we in Henderson, North Carolina. Looking forward, hopefully we're able to join with you guys in Charlotte to the meeting. In advance, I don't have the calendar with me at the moment to let you know what we have going on in the county. I'm sorry.
If you do want us to share, I'll put the email in the chat box, and we're welcome to share that with everyone on this meeting as well.
Okay.
Thank you. So next I have Hector. Good morning, Hector, how are you?
Good morning. Sorry, it took me a while. I'm Hector Denoise. I work with EPA in Atlanta office. I'm the International Activities Coordinator and the Hispanic Employment Program Manager as well. Have a couple of announcements that relates to North Carolina. Recently, our administrator was in Wilmington as part of the bipartisan infrastructure law. And part of that is replacing lead pipes about on the drinking water side. And recently, Wilmington received about $4 million to replace 325 lead pipes. That's a good idea, talking about to avoid issues related to similar to Miss Jackson, Mississippi, and a Flint River area in Washington. So we're doing that. Also, I don't know if you know, we're aware of EPA recently passed a new regulations on managing PFAS. These are what they call forever chemicals related to Teflon, and that this type of chemicals never are very difficult to remove from the environment, from air, water, even from solid waste. But recently, EPA passed a new drinking water law regulating managing on the drinking water side. So that's a great thing. There's some, it's going to take a while. It starts in 2027, different stages to remove, because new technology has been developed and new technologies will be developed to be able to remove all these harmful chemicals. The idea is also for the industry to be able to not produce or not use very common these chemicals that are very common and everywhere, from clothing, anything that is permeable, clothing, furniture, it's everywhere. So we're working on that, and I think that's it for now. And
Hector, I didn't know if you wanted to share about the conference in Wilmington. I did get your email and I will be sharing it with everyone, but I don't know if you wanted to explain a little bit about that.
yes, EPA is, or the EPA administrator is meeting with the ministers of environment from Canada and Mexico in Wilmington from June 24th through the 26th. Although it's a very high level meeting for the three countries, it's going to be, it relates to a lot of conversations going to be environmental justice. There's one day where it's a public meeting where anybody's welcome to participate and learn from what the agency is doing, what Mexico is doing, and what Canada is doing. This is an annual meeting that rotates through the different countries, and you're more welcome to participate if you want to. I know that I sent information to Marlene, and she probably will share more information. We're still working on the details, but I know we know for sure the dates, and more welcome to. And the idea was the selection of Wilmington was because of issues related to environmental justice in the area, plus global warming, flooding issues, and they're going to showcase that during that meeting.
Thank you, Hector. And I did see that if you aren't able to go in person, they will have a link to view virtually. So I will be sharing that information, and thank you again, Hector, for joining us this morning. Next, I have Carla Cardenas. Good morning, Carla.
Good morning. Can you hear me?
Yes, ma'am.
Hi, I'm Carla. I work at the Mexican consulate, and I'm representing my area, that's communities, and I'm here to hear what the community has to offer us and also how we can help. So if you need anything, I'll write down my email or my boss's email so we can get in contact. Thank you.
Thank you, Carla, for joining us this morning. Next, I have Leo. Good morning, Leo.
Sorry, did not want to unmute. Hey, good morning, everyone. Don't have any activities to share, but I do want to mention again the Extra Miles tour report that's available on the link that I had put. Really cool thing about that on that website, you can actually go county by county and they'll tell you when we stopped by that particular county, kind of some of the things that we learned, and who we met with. And then the report gets into a little bit more detail as it aggregates everything together in kind of some of those informed learnings across different counties. Thanks.
Thank you, Louie. And I think hopefully we'll have you join, or someone from your team join us in July to speak a little bit more about that.
I thought it was July or June, I think was
Okay.
the Latino health assessment.
Yes, that one. Sorry. Thank you. So next I have Liliana. I apologize.
Hi, I am just a community health equity coordinator. I'm going to be interning this summer with Mexican, but I'm a freshman at UNC Chapel Hill.
Thank you for joining us this morning. And next I have Lisbeth.
Hi, my name is Lisbeth. I'm also going to be interning at a Mexican in the outreach team, and I'm a senior at UNC Chapel Hill.
Thank you for joining us this morning. Next I have Raj. Good morning, Raj.
Good morning, Marlene. Thank you very much. My name is Raj. I am from an independent organization called Exchange Effect. What we do is we do health education using biosensors to improve health education engagement, especially for marginalized population, which includes Latino, African American, and other socioeconomic disadvantaged population. What I would like to say is I want to thank American Mexican Group. It's been a great resource to connect out in the communities. I'm also a member. I've joined recently, also a PIT Partners for Health, and we are doing community health assessment for 3 years. So all the folks who are in Eastern North Carolina, we are looking for mainly 18 to 24-year-old who's are not included in the need assessment survey. So if any of you guys have any recommendations, I will leave my email address in the chat. You can send it to me for that. The need assessment survey will end in June 28th. So before then, as soon as you can, send us any lead for male population that's between 18 to 24, that would be great. Thank you. That's all I have. And Marlene, I'm looking for this Saturday event, so I will contact you later.
Okay.
Thank you.
Sounds great. Thank you, Raj. So next I do have Topacia. So good morning, Topacia. How are you?
Good morning, everyone. My name is Topacio Alonso. I'm program coordinator with Department of Employment Security. We currently don't have any upcoming events, but I would like to share if you are interested in coming by and pick up some unemployment flyers with this information. I will be at the Braswell Memorial Library Thursday from 1 to 3. And so they're having a job fair there. Thank you.
Thank you. And then I didn't want to leave our last part, Ms. Perez, if you would like to introduce yourself, please.
Hello, my name is Sayuri. I am a communications and advocacy coordinator at Mexican. I'm a summer intern and I'm a senior.
Thank you for joining us this morning. So with that, I know it is 12 o'clock on the dot, so we ended on time today. I just want to say thank you guys for joining again. Thank you for Belen for being here. And we will see you next month. If you guys have any flyers or information that you'd like to share, please send it to our NC Latino Community Task Force email, and I'll put that in the chat again. And I hope you guys have a great rest of your month. Thank you, everyone.
Thank you.
Thank you.